Hello and welcome. Welcome to Hurst Review. My name is Robin, and we are going to talk about fluid volume deficit, the signs and symptoms of fluid volume deficit. I have been a nurse for 29 years. I have worked with Hurst Review as a part-time instructor for the past 10 years, and I work in the marketing department also. I love working with nursing students, so I'm excited to get to talk to you today. I want you to hop in this chat box right here or in the comments and let me know where you are joining me from. Okay, so let's go into fluid volume deficit. Now we know another word for fluid volume deficit is hypovolemia. Anytime you're in a big time shock like hypovolemia, we call that shock. So we're going to talk about shock just a minute, okay? Now, if I'm in a fluid volume deficit, what is my weight going to do? Let's picture this client. What is my weight going to do? Well, it's going to go down, right? That's right. I have decreased or slow skin turgor, rapid recoil, right? Dry mucous membranes. And what is my urinary output going to do? Well, it's going to decrease, right? That's right. Urinary output will decrease. Now, what is my blood pressure going to do if I'm in a fluid volume deficit? It's going to decrease, right? Less volume, less pressure. That's our saying, less volume, less pressure. Also, this client that is in fluid volume deficit, they are at a high risk for orthostatic hypotension. So, you need to make sure that we implement safety precautions, okay? Now, what is the pulse rate going to do? What do you think that pulse rate's going to do? Well, it's going to go up. The heart is trying to do what? The heart is trying to pump what little bit of volume is left to those vital organs. All right, now, what is that pulse going to feel like? Well, it's going to be weak and thready, right? Small like a thread. What about that respiratory rate? What is it going to do? It is going to increase, right? Yes, y'all. Our body perceives that decreased blood volume as hypoxia and increases the respiratory rate to try to improve that hypoxia. All right, look at this next thing. CVP, central venous pressure. What do you think the CVP is going to do? It's going to go down, right? Central venous pressure. Less volume, less pressure, okay? Less volume, less pressure. Now, think about vasoconstriction, your peripheral veins and your neck veins. They're going to vasoconstrict, right? They're going to be really tiny. Now, do you think it would be easy to start an IV on someone that is in fluid volume deficit? Do you? No. Okay. Cool extremities. We all know that when someone goes into shock, their skin gets cold and clammy, right? Hey, we all know that. And since we all know that, is that a question that would be that simple on the NCLEX? Probably not, but we can still pass, right? And Hurst Review can help you do that. Now, think about your urine-specific gravity. What is it going to do? What is that urine-specific gravity going to do? It's going to go up, right? Yes, that number's going up. Hey, if this person is putting out any urine output at all, it's going to be very concentrated. Now, concentrated makes numbers go up and dilute makes numbers go down. And the three lab values that we can apply that to are sodium specific, your urine specific gravity, and the hematocrit. All right, now, we are going to next talk about this NCLEX test, okay? Let's talk about this NCLEX test. It is a safety test. Did you know that? This is a safety test, and it is designed to protect the public from unsafe nurses. Before they just hand you a license, they need to know that you can be safe and that you can keep everyone around you safe, yourself, your coworkers, and your clients. And listen, Hurst has been teaching students how to be safe for over 30 years. This is year 36 for Hurst Review. And this test, that NCLEX test, it's not like your nursing school test. You've learned all of that information. You've got a lot of knowledge, don't you? But Hurst Review will help you prepare for the NCLEX. Okay, now, I want you to answer some questions for me. My friend Thomas is going to question on the screen, and I want you to chat your answer, and I will be right back. Okay, let's read this question together. A client has been admitted for exacerbation of ulcerative colitis with severe dehydration. What is the best indicator that this client has an actual fluid deficit? You see that bolded word best? You will see words like priority, best, most, first. They all mean the same thing. If you can only choose one thing or do one thing for your client, what would you do? So we've got to find out what is the best indicator that this client has an actual fluid deficit. Now, what are you thinking? When you look at these answers, which answer did you choose? All right, I see a couple in the chat, and I see a couple in the Zoom. Okay, so here we go. All right, so if you chose answer number 4, then you are correct, okay? Let's talk about it just a minute. At admission weight of 163.5, 2-day post-admission weight of 158.4. Okay, any acute weight gain or loss, y'all, it's not fluid. Is fluid, okay? It's not fat. It is fluid. So weight is the best measurement for fluid changes. Acute weight loss goes with fluid volume deficits, and the client has lost 2.3 kilograms over a 2-day period, indicating dehydration and fluid loss. Now, number 1, the stool count of 10 episodes of diarrhea in 24 hours. That is incorrect because although 10 loose stools would result in fluid loss, that stool count of 10 episodes of diarrhea, hey, is that an accurate measurement? There is no way to get an accurate measurement on that of the fluid loss. The amount of fluid loss can vary depending on the volume of fluid with each diarrhea episode, and it could be different for each one, okay? Now, number 2, with the second option there, weight gain indicates fluid volume retention and excess, and this question is asking us about fluid volume deficit, right? Also, it does not take into account the client's intake, only the output right there, okay? Remember, outputs, they have less meaning when it is not compared to the actual intake. And then there's answer number 3. Why is this incorrect? Let's talk about it. Well, daily INOs are good information to have when assessing fluid status. But as we said before, there's that diarrhea stools, okay? That is an inaccurate measurement. So your best choice here is option number 4. Hey, what makes Hurst Review so unique? I want to tell you just a little bit about us. We have a 98% plus first-time pass rate. That's right. If you do everything we ask you to do and you follow the checklist that we will provide for you, you will enter the testing center with a 98% first-try pass rate. We have 24/7 NCLEX experts. That's all they do is study that NCLEX. We are a 3-step comprehensive plan. Now, we are not just about taking questions, but no worries. We're going to make sure you get plenty of practice questions. We are a 3-step comprehensive plan. We have NGN-specific strategies. We are a clinical judgment and an application class. Hey, like I said, you have a lot of knowledge, right, from nursing school. Yes, Hurst Review is going to help you apply that knowledge the NCLEX way. All right, also, we have a money-back guarantee. Okay, all right, are y'all ready for the next question? It's a select all that apply. Let me tell you how I want you to answer it. I want you to read the question, approach each option as a true-false option. Now, when you look at the true-false options, all the ones that you choose are true are the answers that we want you to pick, okay? Choose all the right options. Look at them as a true and false, and all of the true options would be the right. Now, let me tell you, you can have up to 10 options, and there is no limit on how many could be correct. It could be 1, or it could be all of them, okay? So chat your answers, and I will be right back. All right, here we go. A client was admitted 48 hours ago with severe vomiting from food poisoning. What data indicates ineffective treatment? Select all that apply. All right, so let's look at this question. This question provided you with some normal reference ranges right there, right? Yes. This is great because it helps you compare the client's values to the normal and then decide if it applies to the question. Now, this question is asking about ineffective treatment for shock. What does that mean? It means that we are looking for options where there has been no improvement or things have gotten worse maybe. Look at option number 1. Blood pressure 96/68, heart rate of 98, respirations 20. Hey, are those within normal limits, those vital signs? Yes, they are. And since I don't have a baseline to compare them to, we have to assume that is normal for this client. So this option is false because it does not indicate ineffective treatment, does it? It doesn't. Now look at number 2, the serum glucose of 70. Y'all, why am I even worried about glucose right here? What does it have to do with anything? Yes, we know that our glucose levels can fluctuate when someone is stressed out or when they are sick, but is it a problem? No. So again, this one is false. This does not indicate ineffective treatment. All right, so here we go. Look at number 3. These values are normal, so this one is false. They give you that right there in the normal reference range, right? So that leads us to number 4, pH of 7.48, a PCO2 37, and your bicarb HCO3 30. All right, with these ABGs, I know this is scary stuff, y'all, but when you take Hurst Review, these will be so easy. And if you are still in nursing school and you struggle with acid base, check out HurstReview.com. On our website, you can find a 4-part series on acid base. It will make it so easy for you. All right, now, these ABGs say I have a metabolic problem, right? And it is alkalosis. Well, if I have been vomiting a lot, I have lost the acid. So if I lose a lot of acid, what do I have left? I have base, right? So this definitely means treatment is ineffective. This one is true. Okay, now look at number 5, urinary output of 25 mils per hour. Hey, it's less than 30 mils per hour, right? Is that a concern? Of course it is. So true. This one is true. So the answers for this select all that apply is number 4 and number 5. Now, let me ask you this. What part of the nursing process does the NCLEX lady want you to see if you wants to see if you understand in this question? What part of the nursing process? Evaluation, right? That's right. Okay, look at the next slide. Hurst Free Events. If you are not participating in all of Hurst Review's free events, you are missing out. Go to HurstReview.com/free-events and check out all the free events or scan the QR code. We have many reviews, NCLEX Challenge, where we do some high-level NCLEX style questions. NCLEX 101, that's that core information that we want every student to know before they go sit for their NCLEX. Scan that QR code. Make sure you're following Hurst Review on all social media outlets. My friend Ashley, she loves to give away free stuff, and she will keep you up to date on what's going on in the Hurst world and in the NCLEX world. And she and her friend Sarah, they have some excellent podcasts that I know you don't want to miss out on. Okay, I have a discount code for you. Free 2025. That gets you $40 off of an in-stream. That is a live streaming review. It's a 3-day review. You can check out our website for convenient schedules. And it gets you $25 off of Hurst Now. Hurst Now is a guided self-paced video, okay? You will do this at your own pace. You will not be on a schedule. You will have a video and you will complete your review. And it also includes $25 off of Hurst Now Plus. That includes Elevate. Elevate is a study companion. It is your study buddy. It dramatically decreases test anxiety, and it improves your scores. And then there's that $25 off of the acid base essentials that I told you about. So be sure and check it out. HurstReview.com. Here's our home office phone number. If we can help you with anything, there's always someone here eagerly waiting to talk to you. All right, that's all I have for you. I hope you have a great day, and we hope to see you again real soon. Bye for now.